As much of the population is eager to move on and be done with the post-traumatic stress induced by the government's response to the purported novel respiratory virus known as COVID-19, many are still being affected by lingering mandates and the financial devastation of the excessive and overreaching nanny state interventions. That is true in the story that I'm bringing you today out of Mackenzie Hospital in Richmond Hill, Ontario, just north of Toronto, where emotional support masking continues to be enforced. That's right. Today, 4 years after the knee-jerk hysteria overtook reasoning, rational thinking, and evidence-based science, certain institutions, such as hospitals, optometry clinics, and others, still enforce illogical mask regulations, forcing people to deprive themselves of oxygen and rebreathe their own lung excrement by claiming that wearing a mask somehow protects vulnerable individuals. Now, an individual who prefers to remain anonymous tipped me off to this ludicrous imposition, which they say they struggle with greatly, especially as the mandate itself seems to be more performative theater than grounded in evidence-based science. If we look at the COVID-19 information section of Mackenzie Health, they even note that their science is different. While masks may no longer be required in other indoor public settings, they recognize that mask mandates are hysteria of the past. Nonetheless, they go on to say that patients and their families trust in Mackenzie Health to care for them when they are at their most vulnerable, and they must ensure that patients receive care in a safe environment. That's why masks will continue to be required in high volume and high risk areas, including the emergency department, urgent care center, chemotherapy clinic, and dialysis units. Mackenzie Health remains a mask-friendly environment, apparently, and they encourage everyone to wear a mask if they feel more comfortable doing so, but not if they don't. Masks continue to be available for everyone and at all main entrances and at the elevator banks on each floor of our hospitals. Indeed, the hospital has its very own mask dispensing machines, which you can quickly and conveniently pull from a pile of questionably sanitary blue surgical masks. Of course, these are the same masks that are ineffective at protecting people from respiratory pathogens. Have a listen to virologist Byron Bridle speak about the filtering capacity of these lackluster filtering devices.
Scientific studies before this pandemic have shown that low-cost masks, and when we're talking about surgical masks and the cloth masks we're wearing, these low-cost masks have pore sizes that range between 80 and 500 microns in size, so a huge range, right? The diameter of the virus is 1 micron. The largest possible small droplet that would comprise a typical aerosol and 2 viral particles is 62 microns in diameter. So I just want to put that in perspective. The smallest pore size is 80. So that means the largest droplet coated with the virus can pass right through. Now, air is always going to travel, the easiest way out. So most of the aerosol leaks out, going up above her nose. The other leak points are right at the cheeks here.
Now, I was able to obtain email communication from someone named Almina from Patient Relations at Mackenzie Health, who informed the individual requesting the efficacy of masking to consult the statements and reports Public Health Ontario and the province's Chief Medical Officer of Health issued throughout the course of the pandemic. But of course, that doesn't mean their advice not to implement sweeping mask mandates or the fact that the province rescinded mask mandates in early 2022. In fact, when the government teased about masking recommendations in the fall of 2022, it was laughable that the Chief Medical Officer of Health, Dr. Kieran Moore, was seen mingling maskless at a socialite event just days after advising Ontarians to mask up indoors. It's peak hypocrisy. Now, I reached out to Mackenzie Health to inquire about their mask mandate, especially since the person who tipped me off about this claims that staff and other frequenters of the hospital are often seen with their masks on their chin, under their noses, or simply just hanging off of one ear in what is peak performative mask theater. I specifically wanted to know what statements and reports they had to reference for the justification of this continued nonsense. My email begins by letting Mackenzie Health know that I intend to criticize their policy as performative theater based on pseudoscience, but offered them the chance to show that this mandate is evidence-based with the following questions. 1. What evidence, including statements and reports from Public Health Ontario and the province's Chief Medical Officer of Health, again, those were Almina's words, not mine, were used to justify this continued mandate? Number 2. Both Public Health Ontario and the Chief Medical Officer Health of Ontario laid out exemptions or exceptions to indiscriminate masking. How is this enforced and upheld at Mackenzie Health? Is there a policy to reference? Number 3, what kinds of masks are required by this outdated mandate? Cloth, paper, N95s, etc. Again, is there a policy to reference? Number 4, the most robust empirical analysis of community masking concluded that indiscriminate masking lacked evidence to support efficacy. Why is the science different at Mackenzie Health? Just a note here that hyperlink leads to the Cochrane Review published in January 2023, which concluded that the pooled results of RCTs, those are randomized control trials, did not show a clear reduction in respiratory viral infection with the use of medical/surgical masks. There were no clear differences between the use of medical/surgical masks compared with N95, P2 respirators, and healthcare workers when used in routine care to reduce respiratory viral infection. And my last question here. Another robust peer-reviewed broad analysis concluded that various health system responses, including masking, lacked empirical justification. How is Mackenzie Health staying up to date on the science as it evolves to ensure its policies, protocols, and procedures meet a high threshold of scientific rationale? That link is the latest study on epidemic outcomes following government responses to COVID-19, which came out last month. That's June 2024. It concluded strong claims about the impact of government responses on the COVID-19 burden lack empirical support. In the grand performance theater of pseudoscience, Mackenzie Health was unable to script any evidence-based justification for their ongoing mask charade, and they did not respond to my media request. For Rebel News, I'm Tamara Ugolini. Much like this tank that I have on here, you can find this and other fun designs at rebelnewsstore.com. It's a great way for you to support our work and also sport some sassy swag out in the wild. And you can also use code TAMARA10, that's TAMARA number 10, at checkout to save 10% off of your total order. All of that at rebelnewsstore.com.